Support for your public radio station comes from our members and from Excellus Blue Cross Blue Shield, with a mission to address health inequities by building up communities and breaking down health barriers. Excellus Blue Cross Blue Shield, everybody benefits. More at excellusbcbs.com.
From WXXI News, this is Connections. I'm Evan Dawson. Our connection this hour was made in a federal budget cut, a proposal that could easily get lost in all the noise coming out of Washington. I'll let the New York Times explain. Quote, the opioid overdose reversal medication commercially known as Narcan saves hundreds of thousands of lives a year and is routinely praised by public health experts for contributing to the continuing drop in opioid-related deaths. But the Trump administration plans to terminate a $56 million annual grant program that distributes doses and trains emergency responders in communities across the country to administer them, according to a draft budget proposal. In the document, the grant is among many addiction prevention and treatment programs to be zeroed out. End quote. For weeks, those who work in addiction services have been cautioning the Trump administration not to go after the many different kinds of funding that help with addiction. And they believed that they had an ally in Robert F. Kennedy Jr., who has been public about his own recovery from heroin addiction. But the administration is ready to cut at least parts of this kind of funding. And the Trump team says it will be up to individual states to address addiction in many ways. The New York Times notes, quote, states and local governments have other resources for obtaining doses of Narcan, which is also known by its generic name, naloxone. One of the main sources, a program of block grants for states to use to pay for various measures to combat opioid addiction, does not appear to have been cut. But addiction specialists are worried about the symbolic as well as practical implications of shutting down a federal grant designated specifically for naloxone training and distribution, end quote. So it's not clear if states are going to just simply absorb federal cuts when it comes to dealing with addiction and still provide everything that they've been trying to do on their own with things like Narcan and training and addiction resources and response. This hour, we're going to talk to guests who can explain what is likely to come next on various levels during a time when tens of thousands of Americans are still dying of opioid overdoses every year. And I want to stress this. We will talk about the numbers. Yes, there's been a decline in opioid deaths, but we're still talking about tens of thousands of Americans, just under 100,000 a year, still dying of overdose. It is a big, big problem. Let me welcome in studio Rob Kent. Nice to see Rob Kent in studio. We've had a chance to talk to Rob in the past on this program. He is the president of Kent Strategic Advisors. He's a former general counsel for the White House Office of National Drug Control Policy. That means he was a pretty big deal in the Biden administration. Rob, welcome. Thank you for being here.
Thanks for having me.
I saw your face. You were a big deal.
Nah.
Well, it's nice to have you in
Ask
studio.
my wife. She would tell you otherwise.
We appreciate you being here in Rochester with us. And let me welcome as well the president and CEO of Huther Doyle. Kelly Reed is with us. Thank you for being here, Kelly.
I'm glad to be here.
Lori Drescher is the founder of Recovery Coach University. Welcome back to the program. Thank you for being here.
Thanks for having me.
And remind listeners a little bit about your own story and your connection to this issue, Lori.
Sure, I'd be happy to. My story is that I started advocating for services in New York State as an affected family member in 2014 when I almost lost my son for the first time. Fast forward 7 years, I lost my son in 2021 to a fentanyl poisoning and continued to advocate and started Recovery Coach University as a solution to the problem to get peers out there in the communities trained and certified to be effective as a resource and support to folks who are struggling to find recovery or sustain their recovery.
We appreciate you being back with us. And listeners, this hour, a lot of different ways to communicate with us. You can send emails to connections@wxxi.org. You can join the chat on YouTube if you're watching on the WXXI News YouTube channel there. You can call the program toll-free, 844-295-TALK. It's 844-295-8255. 263-WXXI if you call from Rochester, 263-9994. Now, we're going to talk about what I've been talking about right off the top here from the New York Times, this idea that the Trump administration is going to try to zero out this $56 million program that looks at naloxone. We'll talk about that. But we're also going to look at a longer list of what is happening. Reuters recently examined the DOGE cuts to see what's actually been eliminated and what the effect could be. And that list is a little bit longer. We'll talk about that. And then we will talk about what states are doing, what the federal government still may or may not do, and the possible effects and what's going on locally. Huther Doyle's got a big event tomorrow that Kelly Reed would probably love to see everybody at. What's happening tomorrow?
Absolutely. So we do an annual breakfast. It's called Friends for Hope Breakfast. It is a fundraiser. It's our largest fundraiser. And this year we have Chris Herron coming. Chris was a former basketball player for the Boston Celtics. Boston Celtics,
Yep.
and lost his career to his addiction. He was addicted for many, many years, and was traveled around several countries playing basketball. Found someone to supply him with heroin in every one of those countries.
Wow.
Had a couple of his children. Was in recovery at that time. Someone from his past called him and said, "I'll give you a deck for free if you want to meet me at a certain street." He did, and he overdosed. And his wife eventually said, "I can't let you do this to the kids. You either need to get clean or you need to go away." And he got clean. And since then has been an absolutely amazing advocate, uses all of the money that he makes from his traveling around the country to tell his story, to open wellness centers, particularly has an attachment to young people. We have some city school district and some Fairport school district youth coming to our breakfast to talk about addiction. I'm very excited about that as well. It's a very important topic, and the message is hope. As you entered the start of the program, one of the things you mentioned is all the things that we're facing right now in terms of crisis and the uncertainty of where we sit with funding and those kinds of things, and the continuing opioid epidemic. But there's still hope in the message and hope in the process.
People can still attend tomorrow morning?
Absolutely. We
Start-
would welcome them.
8 a.m., Eagle Vale Golf Club for the 6th Annual Friends for Hope Breakfast. We'll have information in our show notes if listeners want to register and learn more.
Thanks.
And be there tomorrow. Now, Rob has never been shy about being critical. I mean, that's part of what Kent Strategic Advisors does, is looking at what states are doing, like New York State, when it comes to drug policy. And Rob worked at the highest levels on national policy. So let me start with this story out of the Times. Rob, when we hear that the Trump administration wants to zero out this program that provided training for emergency responders and distributed doses of Narcan, you think what?
So first off, it's a proposal. So the process, the Office of Management and Budget goes to all the agencies and says to them, we want you to propose cuts so we can put a budget together that spends less than what we're spending now. And it's in the process of going back and forth. It's not a proposal yet. It's something they've recommended. I'll just tell you, in my work, we'd recommend stuff we knew they'd never take just to do that, to have stalking horses, if nothing else. So I don't know that they'll cut it in what they propose. But here's the important thing is the president proposes a budget, and they're done at that point. It's totally Congress's prerogative.
Mm-hmm.
You read the Constitution, and it's being read frequently right now. Congress has the power of the purse, not the president. And so,
Is that what you think?
well, that's what I know. And we're going to have the courts reaffirm it for us all over the
You
country.
think this Congress is going to stray from what this president wants?
I think the House has 3 votes they can afford to lose. And I think they've got 3 votes that they would lose on most of these proposals. And I will say as well, addiction issues, unlike most other issues in Congress, there's actually some bipartisan work. And so so many have been affected. It doesn't, as we know, it doesn't play political favorites. So I question whether there's the votes in Congress to do things like that.
Okay, but a couple of things here, though, Rob. I understand your point that when you were working in national government, you throw out proposals knowing it's probably not going to get all the way there. It's like a kid who asks his parents for $20 when he really needs 10. I get it. Why is anybody talking about zeroing out this program in the White House? Why is that anything that would be considered the direction they want to go?
I think there are people involved who don't understand these programs. and I'm trying to be polite about that. I just really think there are number crunchers involved, and they got to make the math work, and they don't understand the policy or the impact of the program. So I think it's more than that. It's more that than anything else. And you did point out, they also have proposed to keep the two major grants basically at the same funding level. The block grant, which goes to all the different states. New York gets about $100 million from that every year. And the state opioid response funding, which has been in place since the end of the Obama administration, through Trump, through Biden. They propose, and New York gets another, I think, 50 to 60 million from that as well. And at least what they're proposing, at least what I've seen in the pass back, which is still not final, they're keeping them at the same levels.
Okay, and I also take your point that this may be one of the more unusual places where there is bipartisan agreement, a lot of bipartisan work for a lot of different reasons. When you say there's 3 votes at least on the Republican side who have a slim majority in the House that you think would block this, is that just based on the years of work that you have done that says when you talk about addiction, when you talk about opioids in the last decade, it becomes less of a red and blue issue?
Yeah, absolutely. Huh. And I, I've talked to a few of the Congress people, and this impacts their districts, and their districts are not the state of New York. They're a small little component of the state of New York, and they're all running next year. That's the other thing. Is
sure.
like
yeah.
a third of the U.S. Senate's up for re-election or election, and all the House, and every seat in New York State's up for election next year.
Yeah, and this is where my mind lately draws a lot of parallels to the proposals to cut things like the Corporation for Public Broadcasting and the debate about whether that's going to happen. I cannot speak without bias on that issue. I think listeners should understand that. But some of the conversations we've had recently is like, well, listen, there are states where there would be just devastating impacts if they don't have their PBS, if they don't have, because in Rochester, I mean, it would be, 18% of the budget. In Philadelphia, maybe 8% of the budget. In some of these communities, it's 60, 80, 100%. And in Arkansas and in Georgia. So you think, well, they're not going to vote for that, but I don't know that they won't. I don't know.
But you're hitting on, I think, a broader theme within all of this, which is the impact of these cuts probably impacts red states and red districts and blue states more than anything else. It certainly is on addiction issues. If you eliminate program, I'm guaranteeing most of that money goes to rural communities, the naloxone money. And
where there's a lot of addiction.
Yeah, and the lack of access to you need transportation if you can find it to get to treatment. Yeah. Treatment's not there. So a lot of people die. And alcohol is as much a problem as opiates. It's worse, actually, than opioids.
But we shouldn't be doing policy based on whether more people will die in a red county or a red state, right?
Oh, I agree. But, it's like there's what I'd wish it would be, and then there's what it is. And so you have to deal with the realities. And I think that with so much of this right now, you got to put pressure on people who are going to run again or want to run again next time. And and you see all across the country, these town halls aren't going all that well for both parties, by the way. People are pissed off, and they're not. You can see it and react to it now, or you can feel it next year when you try to run for re-election, in my opinion.
I was watching Kelly Reed's reaction. Kelly's president and CEO of Future Doyle when Rob said the people involved who want to zero out some of these programs don't really understand the issue. Mm-hmm. And you were nodding along with that. Mm-hmm. Why?
I think that a lot of the situation, and I was in little p politics for a period of time in my career. You aren't an expert on everything, and you can't be. They're really designed to help the elected official achieve what they have recommended as a budget target. And they don't necessarily always understand the bottom line impact that it's going to have. And the bottom line impact is extraordinary in these situations for all the reasons that Rob pointed out. For me, we have experienced the DOJ cuts. that has come home to roost for us. And I take the position that, think globally and act locally is where we're at right now. I can tell you, I just read an article this morning that the U.S. Economic Policy Uncertainty Index is the highest it's ever been, except during the pandemic. And I think a lot of it for someone like myself or anyone running an addiction facility or working in this field, uncertainty is the name of the game. But here's the deal. So is commitment. That's the name of the game for us. I will not let the threat of federal policies determine the manner through which Hugh Doyle delivers its services or the amount of commitment that we place on these roles in our community.
But what do you mean when you say you've experienced the DOGE cuts?
So 2 of our grants were cut. And, they were cut. They were both grants that were scheduled to end, one in June and one in September. There was a reinstatement that was subsequent to that, but we had already taken the action to eliminate the programming and redirect our staff. So we chose not to participate in the redirection. The decisions and the rescissions can really move you back and forth so much. I have to tell you, though, that one of the folks that did outreach, because you started the program on the outreach and the Narcan and getting it to folks, one of our staffs who is retired but is a per diem with us said, I'm going to continue to work for you as a volunteer because this is just too important to let go of.
When you say, though, Kelly, I just want to make sure I understand here that one of the positions was going to end in June, one was going to end in September. And the DOGE cuts eliminated those right away?
One of the grants. One of the grants was going to end in June, and one was going to end in September. And when we received the notice, it was effective immediately today.
Effective today. To do what, though?
They were just going to stop funding both of the programs. They were both outreach programs.
Okay.
So a lot of what you talked about in terms of outreach, getting to the streets, getting to the people that are most impacted and most likely to suffer from an overdose, are where we receive the cuts.
You want to add to that, Rob?
Yeah, so I think March 24th, I want to say, in that range, HHS notified all the states that they were terminating funding contracts that distributed funding. It was COVID stimulus funding. It was from both Trump 1 and Biden 1. And it was immediately challenged in court. And it's been enjoined. They've stopped them from making the cuts, so states are still actively trying to spend the funds. And it's the same legal argument that's going to fly with most. The president, at least for most lawyers like myself, does not have the authority without an act of Congress to stop paying for something that Congress appropriated. And then beyond that, with the contracts, one of the other arguments is that there's this thing called process and notice, which seems to be a missing thing right now, that a contractor is entitled to before a cut's made. Now, that being said, Kelly as a CEO has to make decisions. If this was already going to end in the summer and the fall, do I continue to work at this, or do I make decisions for the best interest of my organization? Mm-hmm. And it's the same thing that's going to. I don't suspect that's the end of us seeing these kinds of terminations of grants and awards. What I do think is going to happen, because this case and the case when OMB issued the spending freeze, which was stopped as well in February, I think the federal district court in Rhode Island is going to be very busy, because that seems to be where all the state attorney generals are going to file litigation. And I think they're going to win ultimately, because when you follow our Constitution, it's beyond that as well. I'm giving a legal lecture here, but there's another law called the Impoundment Control Act.
Yeah, and Trump would not be the first president to try to
everyone's tried to challenge
impoundment.
Yeah.
But they haven't won. Trump seems to think that he can successfully impound.
He's
Allocate-
tried, and the
allocated
courts,
money, yeah.
courts are going to, what I would say is on so many things that we just assumed and followed in terms of what you can and can't do doesn't seem to be part of what's going on right now. So we got 3 branches of government. Congress and the courts are probably going to tell us a whole bunch in the next 4 years.
Well, before I bring in Lori, let me just one other point that I wanted to ask Kelly about here. I'm going to read from Reuters' list here. So Reuters put out a piece examining the DOGE cuts to see what has actually been affected already. This is from their report. Quote, government drug researchers have been sacked. One of the nation's premier narcotics testing labs has furloughed chemists who test the potency of illicit drugs. A Pennsylvania outreach center that distributed thousands of doses of overdose reversal medication has closed its doors. An Illinois nonprofit that works to reduce overdose deaths in communities of color is slated to lose grants and about 60% of its budget. The Office of Federal Workers, who conduct the nation's only annual survey on drug use, has been gutted. And the New York Times added to this list with the following. Other addiction-related grants on the chopping block include those offering treatment for pregnant and postpartum women, peer support programs typically run by people who are in recovery, a program called the Youth Prevention and Recovery Initiative, and programs that develop pain management protocols for emergency departments in lieu of opioids. That's a list of 9 things, and it's probably longer than that. So I guess what I want to ask you, Kelly, is when you talk about the positions you've already cut, when policy really matters in this way, it is not just about did you cut 3 million here or 30 million here. It's are people dying? Are people not getting access to treatment? Do you think that's going to happen?
Oh, 100%. One of the things is that there's such a stigma attached to drug use, and we're still struggling to re-enter folks who used to come to treatment pre-pandemic. We're only at 60% of the folks that we served pre-pandemic at this point. So we're already struggling to keep folks alive and to pull against the pull of the drug is sometimes deeper than the pull of our caring hearts. And that's a tragic story. So when you cut things like the studies of the analogs for what is in the drugs, it's just so frightening to me because people are dying. And right now we're celebrating. We were up 23% in 2023. The Monroe County report indicated that we were up 23%. And we do have a slight decrease in opioid deaths right now, but there's a stark increase for Black and African Americans and Hispanics. We cannot stop the work we're doing. We have to remain diligent, and that's what frightens me about what we're talking about here. I do want to clarify that we cut our program. We cut the grants were cut, but we did lose one position, but we redirected everyone else to actual counseling services.
Okay. So, Lori, how do you see everything that's going on in terms of the allocation of resources, the prioritization? A lot of the buzz is on. Here it is, right here. I think I printed it up for myself. Where's the number? Every time I see a story on opioid deaths lately, I'm seeing the numbers that are down. The CDC said last month the trend line around opioid deaths is encouraging. 24% decline in overall U.S. drug overdose deaths. Provisional data showing 87,000 drug overdose deaths from October 2023 to September 2024. I mean, it's a huge number, I think, still. But it was 114,000 the previous year. We've talked to Rob in the past on this program about, don't over-celebrate, year-to-year trend line numbers when you've got tens of thousands of people dying of overdose. How do you see everything right now?
It's exactly how I see it. I think for a lot of people, they look at those numbers and it justifies the bias that already exists.
Or cutting resources?
For cutting resources.
We're doing better?
Like, this is easy. Whatever we've done, it's working. It's going to continue to go down. And there are a lot of myths out there, and Rob's probably the best person to address that, about why some of the opioid data is showing a reduction, which is terrific. But it doesn't change the fact that in the last 10 years, we lost 1 million people to overdose deaths. And $87,000 or $100,000, something ain't working. And it doesn't mean that we should be turning back, dialing back the dollars. We've gotten better. We've gotten more strategic. I can say we have more peer advocates out there on the street doing things like Kelly's program, outreach, and I hope to God they didn't cut the mobile van.
No.
Thank God. But this is what's saving lives, having people in the right place at the right time when people are ready to face their addictions and then being supported in a very specific, loving, compassionate way. And then we've got folks who are making decisions based on their own personal biases and numbers that are superficial at best.
But there's, I think, two kind of justifications I'm hearing from the federal government, Lori. One sounds like this: there's just too much waste in government in general, and that people want the waste gone, and we're going to target waste, and that's the first step. The second thing I hear is that the DOJ team really believes that you cut, and then when you see something really hurting, then you will have revealed something that should not have been cut, and you restore it. What do you make of that approach? You think that can work?
I don't think it's a very strategic approach. And I don't think that we should be spending 3 years analyzing a problem before deciding, what the solution should be. But the fact that these people come in and they make decisions and make jokes about it. Elon Musk with the whatever
with
that
a chainsaw
tool is. I've never used one, but yeah, it's insulting to our greater intelligence, and yet there are people out there who really buy into that, the theatrics of it. The truth is, this was a, ready, fire, aim process. You can't come into office one day and begin cutting huge programs that affect many, many lives at the speed that they did without having any kind of a plan or doing any kind of analysis about what the fallout is going to be on those programs. And that's exactly what they did.
You've seen it yourself up close, and you've gone through the most painful kind of loss. You try to help families prevent that. What is needed most right now, specifically, to try to take it from a situation where we're not celebrating that it was 100,000 deaths last year and now it was 95, till we get those numbers down to something very, very small? How do you get there? What is needed most?
We need to stay focused on the programs that we know are providing positive outcomes. When I hear about things, I can't speak as eloquently about it as this one beside me can, but it doesn't take a rocket scientist to look at some of the programs that are being cut, and I'm thinking about the ones where we're able to test the drugs that are on the street and see what's in there and know how bad it is and what we need to do to either get it off the street and to treat people who are coming in being affected by it. Why would we cut something like that? Why would we cut naloxone from being in people's hands? How many people in our country today are saving lives because they're carrying naloxone? Our police officers will probably stop carrying it if this is the direction and the message that is being sent. It must be sent that it's not saving lives. And the fact is, it is saving tons and tons of lives.
Okay, so here's what I want to do. We have to take our only break. We're going to come back and we're going to look at what then happens at state level. One of the things we heard from state representatives like Jen Lunsford, for example, a member of the New York State Assembly a couple months ago on this program, was as these kinds of events unfold with the federal government, you will see a lot of states adopt their own strategies to try to, in their view, perhaps mitigate some of the effects. So what's happening on the state level? What do Rob, Kelly, and Lori want to see at least happen there? We'll talk about that on the other side of this break on Connections. This is Connections. I'm Evan Dawson. CY writes to us to say, I think a large part of the conservative mindset is that people and families and individuals and communities and states should manage their own business. And it's not the federal government. It's not the federal government's job to get involved. It's not a one-size-fits-all approach. So that's why they would be in favor of cuts, even if it's to successful existing programs. That's from CY. What do you think, Rob Kent?
So, what I learned at the federal level is we don't make as much policy as people think. What we do is we drive money to drive policy. And so I think these massive cuts that have been proposed would be, they would cause a lot of havoc, a lot of lost lives. If you want to take that approach, good. Give the states the money and let them manage it and get completely out of their way. Don't tell them what to do on policy, and then judge them at the end of it. Did they reduce overdose deaths? Did they reduce alcohol-related deaths? If they did, they keep the money. If they don't, then I guess you go back and look at what they do. But, the overarching thing that I keep, because I'm being asked to talk to groups all over the place, right? Because they think the world's coming to an end, and I don't agree with that. But, if you feel a particular way, including CY, go advocate. Your members of Congress and meet them when they're home. Don't go to Washington. It's too expensive. And it's not worth it. Everyone's trying to see them in Washington. Meet them where you live, where they live, where you vote and they vote, and let them know you care about issues. And I keep telling folks, do you know your Congress people? If you don't, why not? And if you do, that's great. Are you a resource for them and their constituents? But get there and tell them what matters to you, and then hold them accountable. And you can do it, by the way. I'm not a big fan of people showing up and screaming and yelling, because then I think all that happens is everyone focuses on the screaming and yelling. And it makes good theater for MSNBC and all these 24/7 news shows. I don't know that it's all that productive and effective. Be respectful, but be straight and hold them accountable. And if they don't do what you think they should do, vote them out.
You're hearing Rob Kent, who is the president of Kent Strategic Advisors, former general counsel for the White House Office of National Drug Control Policy during the Biden administration. Kelly Reed, president and CEO of Huther Doyle. What do you make of CY's point that, maybe the mindset is everybody's kind of on their own. We're not going to set a top-down policy. Figure it out for yourself.
So I think that it's really important that we stay the course. I find it so offensive to hear something like, let's cut it and see if the concern rises, then we'll know it's a big problem. For Lori Drescher, it failed 100% of the time. And she's lost the future of her life with her son. We can't measure our policies, our practices, and our funding based on that kind of decision making. We need to base it on solid research and expectations that we will change the trajectory of overdose and drug and alcohol use. We have to stay the course, and we have to be committed to it. And I think if I had an expectation of New York State, I would say that we need to use the opioid settlement funds well, and we need to get it to the communities. There's a lot of conversation. I have a favorite saying that it takes government an hour to make minute rice. We get in our own way. Government gets in its own way, and we don't have time for that. We need to look at what is working, and there's plenty of studies that demonstrate what is working. We need to get the money to the people that are delivering the services and get it onto the streets and into the programs and start to make a more powerful difference with them. If you give us the money, we do make a difference. We have demonstrated that over and over and over again. We are saving lives, and we are changing the trajectory of people's lives. So I would ask that happen. I would ask that the state be more responsible in making the managed care organizations pay us the rates that we are entitled to. They do not. They are slow to pay us even when there's an increase. They often don't unless you apply pressure to them. And I would ask also that the state have someone who coordinates all of the efforts. Certainly no shade on those that are working at the state level right now. I think they're doing a really great job. But I think someone who's kind of a drug czar who focuses on what needs to be done in our state, especially in this time of uncertainty, would be a great position for the governor to create.
Lori Drescher, anything you want to add? Lori is the founder of Recovery Coach University.
I agree 100%. And in fact, I'm part of a group of family members who are advocating for exactly that, to find a more efficient way of generating resources, of bringing resources together. It's complicated. It's a complicated system. And then you have, the substance use disorder side of things, and then you've got the behavioral health and mental health. And we all know that these things are connected. However, our systems are not so well connected, and that requires a great deal of coordination. And when we spend that much time coordinating, we are losing time and we are losing people. So I fully support the idea of having a drug czar. We know it's very successful in other states. It was successful at the federal government. When this guy was there in the Office of National Drug Control Policy, and people are very focused and have their own areas of expertise. We need somebody who really knows this subject and knows the players and can make it all happen.
So what happens, Rob Kent, if that is in place, at least on a state level? What might happen?
So let me tell you one specific thing where it would matter. And I worked on this when I was in state government as the counsel at Oasis. So we made a big effort to create one set of rules for outpatient programs to treat mental health and addiction and basic primary care in one place, wherever the person went. We got so far, and then you'd hit a hurdle. DOH had an issue or whatever. OMH had an issue, Oasis. And you know what happens is every day that you're putting fires out to start with when you work at that level of an agency. Somebody dies in a program, that's going to take a bunch of your time that day. So you stop doing the stuff that you've hit roadblocks on, and you go back to doing all the other stuff you do every day. And eventually, months down the road, you're like, hey, we totally forgot about this. So, and I can speak from it now from this unique perspective that I was at the state level at an agency, and then I was at the federal government where there's this oversight office. And it matters because the simple fact that you can force people to the table in a centralized drug czar approach is one of the most critical things. You got to get them in the room to get them to agree. And so having that would be huge. And there's no integrated mental health, addiction, basic primary care in inpatient programs. And so people ping pong all over the place. We waste a ton of money on it as well. So getting all these agencies in the room that impact drug policy and funding related to drug policy, we are going to create one set of rules for all of treatment. Wherever you show up in this state, in an Oasis program, OMH, DOH, you could get all those services. And because right now the approach, people fall through the cracks. I call it a canyon. It's more a canyon than it's a crack. Mm-hmm. And so people die because they can't get everything in one place. And so if you had one person dedicated and charged and reporting directly to the governor, this is what I want you to do, right? And I'll give specific examples. We, in President Biden's first State of the Union address, our chief of staff spent like a month in the West Wing, right? Before state, because everyone's throwing ideas at the president. Same thing, State of the State in New York. Mm-hmm. And so you really got to work, and it's got to be something. It's got to mean something for him to talk about it. And he celebrated the 23 million Americans in recovery in his first State of the Union, and he mentioned the term, heaven forbid, harm reduction. It didn't happen just as he was sitting at the Oval Office, at the Resolute desk. Well, I think I'll talk about Ukraine, the economy, and harm reduction. It happens because people report to him and they push the issues, but they push them in a way that his policy people at the higher levels understand. So if we're making progress right now, and I think we are, now, there's a million reasons why, to be honest. So there's certainly more than it was harm reduction. It was naloxone. It's everything, right? And to waste time trying to take credit for what I do is the reason the numbers are going down is such a wasted effort. Go do more if it's working, right?
But Rob, I wanted to ask about this. When you talk about watching the buzz around the Oval Office and what gets into a State of the Union, what gets a president's attention, what gets a president's priority, what gets a governor's priority. President Biden, very famously, has a son who has suffered from addiction. Mm-hmm. And, all of our guests today have talked about the struggle of working on a very hard issue in which policy is often set by people who don't understand the issue very well. I would presume that President Biden has maybe a little bit more of an opening to understand it. Do you find in general that political leaders, state level, federal level, they're more open to the message if they have had someone in that situation in their family?
Generally, yes.
Yeah.
But they also have other people around them, right, who are chirping in their ear who know nothing about this stuff and think about it, other issues. And I can't tell you, working at the state and federal level, how many different policy wonk people I had to explain our stuff to all the time. That's why, like, when we made real progress in New York, the best thing that happened is the governor's folks trusted me, trusted us, and they just let us go do what we were doing. And they didn't ask me to explain everything to them. They trusted because they verified that what we did worked and it made an impact. And we reduced overdose numbers in 2017 and 2018, which, by the way, we now know fentanyl was already in the mix at that point in time.
Yeah.
And why? Because we threw everything at it. Everything. And we're not doing that, by the way, right now. We're just not. But people, take credit for these reductions. And look, I read quotes all the time. And so I saw this quote from Indira Gandhi. She said, my grandfather told me there's two kinds of people, one who do the work and one who take credit for it. And he said, try to be in the first group, there's less competition.
So on that note, let me ask all three of our guests, when we look at the state level, what is happening, Rob, that is working? What is happening? What is not happening that still needs to happen? I mean, I'm reading that back in January, Governor Kathy Hochul signed legislation designed to help combat the opioid and overdose epidemic. And the new legislation requires the State Department of Health to distribute fentanyl test strips along with opioid antagonists, which are medications that block the effect of opioids. And the legislation would also require that an informational card or sheet distributed along with the opioid antagonists contain information about fentanyl test strips and their uses as well. So that's one example. How are they doing? What is not being done? I want all three of you kind of weigh in. I'll start with you, Rob.
One, naloxone, it's simple. The state only buys one version of there's multiple versions of naloxone. They buy one. And tell me when you go to the market and you buy only one product and there's no competition in procurement that you're getting your best price. It's just not the case. So, and they've talked about going out and doing an open procurement. There's like 4 or 5 different versions, different strengths.
So why aren't they?
I'll be polite and say it's simple to keep things the way they are than it is to go do something new.
Don't be polite.
No, it's a very peculiar arrangement with the company that makes the one product and the state of New York and many other states.
A monopoly is profitable.
It certainly is. But those decisions to buy that product, I was part of it at Oasis. They were made when there was one product. There's multiple products now. And so that in and of itself, we've been handing out test strips for years. So, and as we should. And Lori mentioned drug testing. The state invested a couple years ago in putting really sophisticated machines at certain locations, which, by the way, it's not a police department. No disrespect to the police. People aren't bringing their drugs to a police department. Can you test these for me? Mm-hmm. I can do a few other things while you're here. They go to harm reduction programs where people who use drugs go to get supplies if they're doing that. Yeah. And they work because the drug supply, we're beyond now. It was for a while. When April 23 is when I left ONDCP. We had just declared an emerging drug threat, fentanyl adulterated by xylazine, an animal tranquilizer. Yeah. They're on a new animal tranquilizer that's showing up everywhere. And so, the people who make the drugs will always be ahead of us. And they'll never stop creating new drugs because there's always, if there's a demand for their product, they will figure out how to meet the demand. So, Kelly hit on a point. There are tens of millions of settlement dollars sitting unspent. We keep hearing from the state, we've made available all these dollars, more than any other state. And what's made available? Is it the checks in the mail? It might be in the mail. The contract might be somewhere. The money needs to be out on the street. The people like Kelly, the people like Lori. The one thing about this system, when people talk about fraud, waste, abuse, or overspending, this system makes $2 out of a dollar. It always has had to do it that way. So an investment in this system keeps your loved ones alive and keeps your family intact and up against enormous odds.
But the money's tied up in red tape, the settlement dollars?
Well, they got to go through the normal procurement process. I would streamline the procurement process.
Yeah, the economics writer Noah Smith has a term called checkism that is it's the celebration as if on the day that you hold the big oversized check that you got it done. And Noah Smith is on the political left, and he is mostly critical of Democrats in this way. So Democrats love to have those news conferences, and they hold up the big check.
Well,
but what happens after that? Where is it? What's being done?
So 2014, the Senate put extra money in the OASIS budget. That's when we just started to hey, we got a problem. Maybe we ought to do something about it. And by the way, it happened because families, people like Lori, started telling their legislators, you better come home having done something or I'll send someone else to Albany.
Yeah.
So they put money in our budget. I told them we wouldn't spend it. It takes like 12 to 18 months to get a procurement to contract and money in the bank account of that provider. I told them that was going to happen. They said, okay, show us. Let's see. It did. The next year, and for like the next 6 years, they gave us procurement relief. We still had to do a competitive solicitation, but we didn't have to go through all these other processes with the state comptroller and with the attorney general's office. We got all the money out in the year it was appropriated. So that has not been put in place for the settlement funds. And so look at the governor's budget. $500 million has been received by New York State. They've spent like 40% of that money by her own budget. They reappropriated almost $300 million.
Let me ask the other guests then. All right, Kelly Reed, President and CEO of Huether Doyle. What has to happen on the state level now?
So I'm going to tell you two things that are good news. The state is funding us at Huether Doyle for a methadone clinic. The DEA arrives on Wednesday to do the final evaluation of everything we have set up, and we anticipate that we'll be opening very soon. Why is that important? There are folks from Rochester, New York that are driving to Syracuse and Buffalo every single day to get their methadone because we don't have enough available here in Rochester, New York. It is a critical piece of the process when Rob talks about, do everything for the process. Opening more methadone clinics is one of them. The second is another piece that has been raised here is the co-occurring issues and getting behavioral health to coordinate with one another. We are also up for funding a mental health clinic that will open in late fall. At this point, 48% of our clients have a co-occurring mental illness. So they'll be able to get one-stop shopping and be able to be served in one spot for multiple needs. And those are really good things to be done. I agree that we need to have a streamlined process for getting more money to local places where we can put that money on the street.
Lori Drescher, what has to happen in the state?
Oh, Lord, so much to say here in so little time. First, I love the word checkism. And it just makes me think of all of the press conferences that I've been invited to attend or speak at where those giant checks were, front and center.
And they're breaking their arms, patting themselves on the back.
And I'm thinking about the opioid settlement funds. When did that start? 3 years ago?
Yeah.
And I was at that, and it was so exciting. And Letitia James was there, and all of our politicians locally, and it was hurrah, hurrah. We did it, and here we are 3 years later, and we still haven't spent any of the money that's been allocated in the budgets.
Yeah. So
we need to get to the root cause, which in this case, I do believe procurement is a big piece of it. It needs to be simplified, streamlined. That's the truth for most of the state processes that I have issues with. But I just want to say that, this will not make me popular, but I don't care. When did I ever care about that? When we did get stuff done, and there were a lot of laws that were passed between the years of 2014 and 2000 before the pandemic.
Yeah.
Cuomo was in office for a part of that time, big part of that time, and I remember standing beside him as he signed in many bills. There were many laws that were changed during that time. So we do need politicians who are willing to actually listen and understand, what the data is showing and what changes need to be made.
And you're saying Governor Cuomo did?
He actually did, yes,
Okay.
quite a bit. And I would like to take this moment to invite, if there are family members who have experienced what I've experienced, and you have a voice and a heart for advocacy, please join me.
How do they find you?
Lori at recoverycoachuniversity.com. Lori is Lori.
Recovery Coach University is the
.com.
organization.
Yeah.
Lori, you're welcome here anytime. And I hope that you'll all come back as the year goes on here, because we will see what does come out of the final federal budget. We'll see what happens at the state level. And frankly, we'll see if how we're dealing with preventing death in our communities. So thank you for being here, Lori.
Thank you.
And thank you for being here, Kelly Reed. Have a great breakfast tomorrow morning.
you.
Big event at Eaglevale, 8 a.m. More information on our website there with Hugh Doyle. Thank you for being here. And Rob Kent, always good to talk to you. Thank you, Rob.
Great talking to you.
President of Kent Strategic Advisors. More connections coming up in just a moment.
This program is a production of WXXI Public Radio. The views expressed do not necessarily represent those of this station, its staff, management, or underwriters. The broadcast is meant for the private use of our audience. Any rebroadcast or use in another medium without expressed written consent of WXXI is strictly prohibited. Connections with Evan Dawson is available as a podcast. Just click on the Connections link at WXXInews.org.
Support for your public radio station comes from our members and from Mary Cariola Center, providing education and life skills solutions designed to empower individuals and the families of those with complex disabilities. Mary Cariola Center, transforming lives of people with disabilities. More at marycariola.org.